Okay, awesome. So when we look at this case presentation formula, we say, number one, I need to know what's important to the patient. And I'm going to start with that, their reasons. And number two, I'm going to make sure that I know without a shadow of a doubt that this patient understands the condition first before I ever talk about treatment. 95% condition and consequences, 5% treatment. Don't talk about treatment until they're ready. So how that would sound is I'd say, Ricky Bobby, earlier you shared with me it's really important for you to have peace of mind, knowing that, you know, things were going to stay healthy and you weren't going to lose your teeth like your grandfather did. And he starts nodding his head. That's number one. Number two, I say, and as you know, during the exam, we took pictures. We showed you the pictures of all the concerns I have. So anytime we're talking about condition, we always use the word concerned. You are the doctor. Your credibility, right, is super important. They are not going to buy from you if they don't perceive you to be credible. You first have to be able to get them to understand what you're diagnosing. So during the exam process, they've overheard some things, you and your assistant, you and your hygienist talking about conditions that you've seen. So they've heard that word concern before, okay? And then secondary to that, they've also started to hear things like the consequences, what could happen. So here will be you'll be resuming a conversation piece that they've already had earlier. Make sense? So I'm concerned about the infection in your gums, the active infection in your gums, the active decay in those 3 teeth in the upper right. You have old metal fillings that are now breaking away from the tooth, allowing decay to get underneath, and those are working their way through the tooth towards the nerve. I'm concerned about that because of what it leads to. Step number 3, that consequence you see on there, what that leads to. Now, luckily in dentistry, there's pretty much only 2 consequences we have to worry about, problems, conditions leading to. So what is the consequence of gum disease? Just say it. What's the consequence of gum disease? Okay, so bone loss leads to tooth loss, right? So tooth loss is one of our consequences we work with. That's a big deal, right? And number 2, what does decay lead to? Pain. So toothache and tooth loss. Those are the 2 things that your patients have to understand, because what happens when they walk out and Rebecca, the receptionist, has given them a treatment plan proposal for $5,000 and their insurance is going to pay $1,000 of it. They got to come up with $4,000. They're going, well, it's really not bothering me yet. So once it hurts, I'll give you a call. Treatment plan completely changes at that point. So if they don't understand what's coming before that process occurs, right? If they don't understand the consequence of those conditions, they won't feel the urgency to move forward now. What do you guys think is the number 1 objection offices hear from their patients? What do you guys think is a reason for not moving forward? What do you think the number 1 reason is? Okay, go like this, right? Money, go like this. If you said money, right? Money is number 1 reason. And really what it is those people who say, yeah, I can't afford it right now. I really don't want to spend the money right now. It's not bothering me right now. I'm going to wait, right? And then they go get in their brand new Cadillac on their way to Hawaii for vacation. So they have the money, but they don't perceive the value. So really the number 1 objection that I deal with my clients is lack of urgency or value. And the reason they don't understand that is because they're not connecting the problem that you're diagnosing to what's going to happen if they don't do anything. For example, on the physician side, if they have high blood pressure, pretty much everybody knows what happens if you have high blood pressure and you don't do anything about it, and it's a scary thing, right? That heart attack, that's a big deal. If you have diabetes and you're not feeling anything, but they diagnose you with diabetes, that leads to something bigger. They do something about it. So in dentistry, patient's perception is if it's not hurting, it's not really a problem. I don't know why that is, but that's the perception, and we have to change that. So the key here is when you go through why it's important to them, connect the condition to that. Let's say it's active decay, then what that leads to. So how those first 3 sound is, Ricky Bobby, I know earlier you shared with me it was really important for you to have peace of mind. You didn't want to lose your teeth like your grandfather did. And so taking that consideration through the exam process, we pointed out some concerns we had to you on the camera, on the screen. my number one biggest concern for you are the 3 teeth on the upper right that have active decay. There's old metal fillings in there that have now broken away from the tooth, and the decay is burrowing its way down towards the nerve. Now, Ricky Bobby, I'm concerned about that because what happens once that decay hits the nerve? Do you know, Ricky Bobby, what happens once the decay hits the nerve? Now, guys, do you think Ricky Bobby, the average patient, is going to know the answer to that question? What do you think? No, he's not going to know. I don't know. And some people will say a toothache. They'll just throw something out there, random, because it's the only thing they know. Or maybe they've had a root canal or toothache before. So I will share with them and say, well, once that decay hits the nerve, now there's a toothache. Pretty simple. Have you ever had a toothache? And I'll know they haven't because I can see their x-rays, right? Or maybe they have. Or I'll say, do you know anybody who has had a toothache? And they're like, I don't know. Do you know anybody who's ever had a root canal before? Oh, yeah. They know that term. They start nodding their head and they go, okay, well, that's what we're trying to prevent. All right. So at this point, I've laid out, you said you wanted something. You wanted peace of mind. You wanted confidence. You wanted to keep your teeth the rest of your life. You wanted to maintain health, whatever that is, whatever that reason is. And then I presented a problem that's going to become a bigger problem that's going to prevent them from achieving what they said they wanted. That makes sense, guys? Okay. So now it's in the patient's hands. Their job to say if they want to do something about that or not. So then we test the buy-in. Now this question I would ask very specifically. It would be a how question, not a yes or no question. That is very, very specific wording that plays a role in this. So for example, if I did it the wrong way and I say, is this a concern for you? Okay, it's a yes or no question, right? Is this a concern for you? Yeah, I'm concerned about it. Yeah. You will have patients in your practice that we call the yesers or the yes ma'ams. Yeah, yes, yes, yes. And then you leave the room and they turn to the assistant and they go, what did she say? What did he say? I don't understand any of that talk they were just giving to me. And then your assistant or hygienist translates for you. And they don't have buy-in because they didn't understand it. People would rather make no decision than risk making a stupid one. So they don't do anything. Okay, does that make sense? So you have to make sure they understand it. So you hear me using real simple terms. Silver, old metal filling, breaking away from the tooth. Those are things. You can't say you have defective margins on an MODL amalgam and the buccal cusp has an abfraction on it. And I'm concerned about the class 5 furcation, whatever. They don't know any of that. They won't know what any of that means, and you'll confuse them, and they will just freeze in confusion and no decisions made. And you'll wonder why they didn't do anything because you used all these big fancy words you spent all this money on learning in school, and yet they don't understand it. They didn't go to school. They didn't go to dental school to figure those words out. So you'll have to define those things for them, okay? Now, when I say, how concerned are you with that? I don't say, is that a concern for you? Because I don't want them going, yeah, I'm concerned about it, sure. And they go up front and find out it's $2,000 and they're not in. So I'm actually implying something when I ask this question this way. When I say, how concerned are you with that? What am I implying when I say, how concerned are you with that? That it's a concern. That first of all, it has to be a concern, and I want to know to what level it is. Now, implication questions. Here's an example of an implication question all of you have used at some point, depending on how you used it. You've said, are you going to eat that? Now, you might be implying that you want it, or you might be implying that, I can't believe you're going to eat that. That's disgusting, or whatever, okay? So there are such things as implication questions, right? Like, has this tooth started to hurt you yet? You're implying something when you ask that question. Pretty straightforward, right? So during the exam process prior to this, we started planting the seeds of consequence. Has this tooth started to hurt you yet? And they go, no, doesn't bother me. In their mind, they just checked off the healthy box. I'm healthy. I'm good. Doesn't bother me. Don't be trying to sell me anything. They sit down in the hygiene chair. Doctor walks into the hygiene exam and says, don't find anything today, doc. If you haven't heard that yet, you will hear that. They don't want to be pressure sold. They don't want you to sell them anything. And at some point, you'll have some sort of fear of rejection or avoidance of conflict or engagement there, and you have to know how to manage that and work through it. And so when you ask them, has this tooth started to hurt you yet? They'll say, no, hasn't started to bother me. Then you'll need to follow that up. You'll say, I'm so glad that we caught this when you did. I'm really concerned about this tooth. If this tooth were hurting you, we'd be talking about, a major toothache and a root canal and how to get you out of pain. And so I'm glad you're here now so we can address it before that happens. And you move on to the next tooth. You don't treatment plan. You don't propose it right there. You just let that sink in and let them buy into the problem first. They have to buy the problem before they ever buy the solution, okay? So how concerned are you with that? Yeah, I'm really concerned because this is now multiple times they've heard this. I'm really concerned about this, okay? I've got buy-in to a problem. So my 95/5 rule, now I go into, would it make sense then for us to talk about a plan on how we can stop this from getting worse? Yeah, let's talk about a plan. I'm still not saying, let me tell you what you need and putting my hand up and forcing something on them. Would it make sense for us to come up with a plan together on how we can stop that from getting worse? That's really different than saying, okay, well then we'll have Rebecca go over your treatment plan with you and she'll tell you how much it's going to cost. So when you put those things together, they say, yes, let's talk about a plan. You remove the slash between the 95 and the 5 rule, right? You say, okay, now let's talk about treatment. Here's the plan. Well, the best plan is to prevent pain. That means removing the old metal fillings out of there, getting all of the active decay, stop that from hitting the nerve, and then repairing the tooth with white composite material, look just like your tooth, and then we'll put a protective coating over it called a crown, and that tooth will then be healthy for a long time for you. Awkward silence. Stop some more awkward silence. If I don't ask, it gets really awkward, right? Wait, is that it? No. Here's a number for you. 64% of the time, patients don't get asked if they want to even schedule. That means nearly 2/3 of the time, the patient's just wandering out from the back to the front going, what do I do next? Do I really have to do anything? Or was he or she just notifying me of what was going on? Right? Here's the plan. And then I'll hear doctors go like this. They'll say, all right, well, go up front and see Rebecca. She'll get you scheduled. There's no ask in that. There's no ask for a commitment to solve the problem. I want to help you guys out right from the get-go. If you can just do one thing for me, I promise it will change your practice. We are in a great profession where we have an opportunity to get people healthy, which I think is awesome. So the things that we are selling are health, which is phenomenal. And as long as you have integrity in that, you're going to do really well. But I know this, you will have bills to pay when you get out of school, right? And the good news is you get to get people healthy, and it's a win-win. They pay you to help get them healthy. That is a real positive thing. So with integrity, you can do a really good thing for your practice, for your career, if you just remember, ask them to move forward. Now, elementary school is, how soon would you like to get this scheduled? That's an elementary school ask, right? And then you kind of get into high school. Do you see any good reason why you would want to go ahead and get this scheduled? To me, those sound very much like pressure sales, and those aren't for me. They may be for you, okay? Now, you want to go graduate level, college level ask. You could say, would it make sense to get this scheduled? Would it make sense for you to get this scheduled? I think that's pretty good. But my golden nugget, my precious, my precious question that I have my clients ask has the word feel in it. And it is an open-ended question because it creates conversation, so you avoid the yes sir, yes ma'ams, right? We don't want those. So I say, how do you feel about moving forward with this plan? If you can get to a place where you can say, how concerned are you with this? Yeah, would it make sense to come up with a plan? Yes, here's the plan. How do you feel about moving forward with this plan? Well, my insurance. Or how much is it going to be? You guys will end up talking about those things more than you're probably talking about hemisections. So be prepared to have those conversations with your patients, okay? how do you feel about moving forward with this plan? You'll get real honest feedback when you ask that question. It's open-ended. They say, yeah, no, it sounds good to me. Let's go up front and see Rebecca, and she'll go over all the details with you, financial and getting you scheduled. Okay. So let me put it all together, how it sounds. Really simple. So I say, Ricky Bobby, earlier you shared with me is really important for you, peace of mind, that you wanted to avoid any big problems. You didn't want to lose any teeth like your grandfather did. And so taking that into consideration, we talked about the concerns that we have with the 3 teeth on the upper right that have active decay and the infection in your gums. That's active infection that's not going away on its own. Those are 2 big concerns we have. The first, with the active decay, the reason I'm so concerned about that is because if you don't do anything with that, that decay is going to work its way in between that old filling that's broken away from the tooth now, and work its goal is to hit the nerve and cause a toothache. My goal is to help you prevent that. How concerned are you with preventing those cavities from turning into toothaches requiring root canals? Okay, you're really concerned about it. Great. Number 2, I'm really concerned about the active infection that's in your gums. That's called periodontal disease. It's the number 1 reason people lose their teeth. It's probably what caused your grandfather to lose his teeth. And so the concern is get that taken care of now and manage that and remove it and get it to a healthy level where we can manage it so that you don't risk losing any bone, which would cause you to lose your teeth. How concerned are you with stopping that infection now and taking care of it before it becomes a bigger problem? Yeah? Okay, great. Now, would it make sense then for us to talk about a plan on how we can remove the decay, save those teeth in the upper right, and remove the infection and keep your gums healthy? Yes. Okay, here's the plan. You can talk about scaling root planning and fillings and crowns and all those fun things you love to talk about. And then at the end, you would say, how do you feel about moving forward with this plan? Yeah, makes sense, right? Okay, cost, yes. Insurance, absolutely. If we can work out the cost and the insurance and fitting it into your schedule, all those things, I just want to make sure, is this the plan you want to move forward with it? Yes. Okay, so let's get with Rebecca, the receptionist, and let's get those details worked out for you. Her job is to make this affordable, to manage your insurance, to maximize your benefits, and then to figure out how to get our schedules to match up. Now, urgency. You're going to want to make sure the patient understands how urgent things are to get them done. Let me ask you guys this. If someone has this sort of situation that I've been describing in their teeth, how long do they have before it turns into a toothache? How long would you say? Do you know the answer? Probably not. You don't know. So when they say something to you like, well, how long before I have to do this? You can say to them, you could have 3 weeks, you could have 3 months. I don't know. The goal is to make sure you do it the day before it hurts. And they'll think about it for a second and go, well, how do we know when that is? We don't know. We just know it's going to happen. So sooner the better. Okay. You have, your mouth is like a house, right? It's a 4-room home, 2 upper rooms, 2 lower rooms. And we can see from the outside, and we can see the candle lit in each one of those rooms, you know, and that candle represents decay or infection or a broken tooth, whatever it might be. And you say, well, we got to blow out all those candles. And if you let them continue to burn and burn and burn, now you're at risk of a fire in those rooms. And if you say, well, I'm going to take care of the upper left room this year with my insurance, and I'm going to take care of the lower right room next year with my insurance, by the time you get to room 3 and 4, you know, 2, 3, 4 years from now, they're going to be charcoal. They're burnt down. And it's going to be more expensive. You're going to rebuild those rooms. And so the goal is to burn out all of these candles before any of that happens. So I'm describing condition and consequence. So come up with your own way that you would describe this to your patients so they actually get what you're talking about. Keep it really simple. The more complicated you make it, the tighter your budget's going to be and the less patients you're going to have on your schedule. If you think you're going to get patients in your schedule because you're in network and they're just going to come to you for that, then they're coming to you because it's inexpensive. And as soon as you start talking about things that are going to require more than that, it's going to become really hard. You want them to come to you because for the right reasons, right? Just like in a marriage. So don't make it financial. Don't make it based on insurance. Make it based upon your relationship with them and your ability to communicate and to do as much dentistry as possible to get them as healthy as possible, as quickly as possible. Okay. Make sense, guys? All right.
Eric, question.
Yes, go for it, Dr. Harrison.
Okay, so you go to test the buy-in,
Mm-hmm.
and they have not passed that test.
Okay.
What do you do?
All right. So you say, how concerned are you with this? They go, yeah, it's not really bothering me. It's not really that big of a deal. Well, okay. Well, have a great day. We'll see you next time at your hygiene visit. That would be called agreement, and that's a no-no. You can't stop there. You also can't argue with them. Well, what do you mean it's not a problem? You didn't hear what I just said? I pointed out to you it's a problem. You're going to lose your teeth. You know that, right? You can't get into argument either. You need to acknowledge what they're saying and then seek to understand it so that you can help solve the issue. Because if you've done this really well and you've painted the picture really simply and they're going, yeah, if it ain't broke, don't fix it, right, doc? That really wouldn't add up to. Or if they say, well, it's not bothering right now, so I'm going to hold off. Then we're going to play it forward. I'll acknowledge it and play it forward. I'll say, well, Marky Mark, I get it. You know, you're wondering, you're processing these things and you want to figure this out for yourself. I get that. Let me ask you this. Are you saying that if it was bothering you right now, if you were having pain and sensitivity, that you'd want to take care of it at that point? You'd take care of it now? And he'd probably say, yeah, if it was bothering me, I'd take care of it. Okay. Well, let's talk about that, because I don't want you to be frustrated with us later on when you call us with a toothache, and understand that everything changes at that point. No longer will we be talking about this plan that I presented to you now, and in prevention mode, we'll have to add in another sequence of events, being a root canal. That will get you out of pain, and then we'll proceed with the original treatment plan to then restore the teeth to health. So you have two choices. You can do that plan like we talked about now and prevent the expensive root canal and the pain. Or if you like, I'd love to practice doing some more molar endo on number 3. Those are a lot of fun. So you can wait until it hurts, and then we'll get you scheduled for what we call root canal, and then we'll move into the plan. Which would you prefer? And so I lay it out for them, because they obviously don't understand the difference between what we're talking about now versus then. Now, I'm being a little bit facetious with the practicing root canal and having fun with you guys, but they don't know what's coming if they don't do something until it hurts. You have to make sure you play that forward. If they say, well, I only want to do what my insurance covers, you're going to have a highly trained team that's going to deal with your insurance challenges. But you could say, well, your insurance absolutely is going to play a role in this. We need to figure out what that is. If they don't pay for it, and you decide not to do anything, and you end up with toothaches and broken teeth, what are you going to want to do about it then? You play it forward. You let them know what's coming if they don't do something now. Does that help, Dr. Harrison?
Yeah, I think that's great. And then once you've had those conversations, you can then test the buy-in again.
Yes.
And ask that question, you know, how concerned are you with the things that we've talked about?
Absolutely.
I think that's great. So it's just like you said, the 95/5, you go up into the slash, but you don't proceed forward until you have that buy-in.
No treatment is discussed until they say, yeah, I'm concerned about it. What do I got to do to fix it? Absolutely. Okay. So I want to tweak this, because I want us to understand that I've been doing a generic version of this, but you guys have taken the disc profile and you've done that for yourselves. Is that correct? Nod your head if you know disc. You know what your disc is. Okay. So really what happens is then this formula, these steps, right? Why, condition, consequences, test the buy-in, get the commitment. When you go through all of this, you're going to tweak that based upon their disc. Some of you who are D's in the room have been like, this is way too much information. This is so simple. We could do this so much faster. Hurry up. Let's go, let's go, let's go, right? Some of the C's in the room are going, wait a minute. I'm not going to describe the 5 characteristics of decay and whatever it is, right? And lay out all those details. And so it's really important for you to read the patient. So when you're using DISC, there are 3 levels of application. Number 1, know yourself. You took a DISC profile to understand what your DISC personality type is. I'm an ID, so I have a high I with a backup D, all right? And then level 2 is to be able to identify others. So I gave you a handout that you can use to simply identify others, and I'll explain how to do that. And then number 3 is adaptation. You need to adapt to their style so that you speak in their language. If you're speaking in a different language that they're trying to listen in, they're not hearing you. They're really not getting it. So you know that D's, right, bottom line, very extremely direct, just get to the point people. This is an extreme version of that would be Donald Trump, okay? Then you have your I's. They're outgoing. They're very talkative and expressive. They're distracted, squirrel, that sort of thing. These high I example will be Will Ferrell, okay? You can picture that in your mind. And then your S's, very steady, very calm, very people-oriented, but they're not going to rock the boat too much. So this would be, Tom Hanks, Meg Ryan, those types. All right, so I might be dating myself. I might not even know who those people are. Do you guys know who Tom Hanks is? Raise your hand if you know who Tom Hanks is. Okay, all right, good. Whew. I'm not too old yet. All right, and then on the C side, compliance, this is your Bill Gates, your scientists. Many of you probably fall in this category, the C category, your left brain analyticals, okay? So here's the challenge. D's want something. They want to be in control. I have to have control. Think about that when you think about Donald Trump, right? I's they need recognition. Will Ferrell, all about recognition. S's, they need harmony. Got to have peace, even keel. And then the C's, they need accuracy. So when you're talking to each of these patients, you need to adapt your style to them. Well, how do I know what their style is? Very simple. I gave you the questions right here on the grid. The outside of the box, you just ask these two either or questions. So I would say, all right, let's do Jimmy Fallon. I say, is he extroverted telling or is he introverted asking? We all know he's extroverted telling. And is he people-friendly or task-driven? Oh, he's people-friendly. So the only box that is people and extrovert is the I. Very simple to ask two either-or questions and you get the answers, okay? So for Dr. Harrison, is he extroverted telling or introverted asking? You think he's top or bottom? What do you guys think? Maybe a little bit of both? Okay, maybe a little bit of both. Is he more people-friendly or more task-driven?
I believe they don't know me.
He's a chameleon. All right, so Dr. Harrison, would you say you're extroverted telling or introverted asking?
Oh, I'm extrovert.
Okay, extrovert telling, so we know he's top of the grid. And is he people-friendly or task-driven?
I love people. I'm task-oriented.
All right, so would you say you're a D then?
No, I'm probably, well.
ID?
I don't remember what mine is, yeah.
ID? I think you're an ID. People-friendly with some task-drivenness to it?
Yeah.
Okay, all right. So the I is there. So you need to be able to ask these questions about your patients. And you would do this in hygiene. You have your hygienist do this well, so it's documented. So that when you walk into the room, you just don't put them on blast because you're a D and you blow their hair back an S. They're going, wait a second, this is all scary. Why is it so fast? She's already gone. Where'd she go? Where's the doctor? I have so many questions. Okay. So you need to put that hat on when you walk in. You have that D-I-S-C hat, and your team's got to prep you on that. So if I were to do a D version of the case presentation formula, I would say, Dawn, you said you wanted to make sure that everything was healthy and it maintained a level of health. And so I took that into consideration through the exam process. And my big concern is how this active decay is going to cause bigger problems down the road when a toothache happens and it interferes with your schedule and it causes a real problem. How concerned are you with preventing that from happening? I start nodding my head. When I nod my head, Don starts nodding his head, right? Okay, yep. He goes, yeah. All right, well, makes sense to come up with a plan together on how we can stop this? Yeah, what is it? Shoot, doc, right? Okay, 1, 2, 3, that's what I would do. Would it make sense to go ahead and get this scheduled? Yeah, that makes sense. All right, go up front and see Becky. She'll get you taken care of. And somebody will walk the patient out. I don't ever send them out alone. And then a transfer occurs. When we get to the front, my assistant, says to Rebecca, the receptionist, she says, Don wants to get these 3 teeth taken care of. It's really important for him to have peace of mind knowing it's not going to interfere with the schedule. And so he would like to get this schedule taken care of as soon as possible before those 3 teeth become a bigger problem. Right, Don? Because I don't want the patient to just get dumped off at the front I go, all right, all set. We'll see you next time for those crowns. If you have any questions, let me know. And then he looks at Rebecca and goes, yeah, I'm not going to do that. Right? You got to have that communication, that commitment transferred between team members. Now that's the D version. The S version, the C version are very different than that. There's softness and steadiness. There's harmony to the S, and it's all about prevention. And then on the C version, there's all kinds of details going on. If I do the I, we might even high five at some point in the process, okay? We'd have some fun talking about cars and whatever they're doing. I build relationship through this process. This DISC really can really help you right out the gates to build your practice, because people like being around you when you communicate in a style that is effective to their ears. Right, guys? If you're just you all the time, right, you're gonna hit a certain percentage of the population all the time. It doesn't mean you need to be phony or fake the whole time, but when it comes time to deliver the message, you need to deliver it in a style that works for that patient. Make sense? All right. We covered a lot today, Dr. Harrison.
We did. Are there any questions? I've got a question, but I want to give you an opportunity to ask one. No questions? Okay. I know we got a few minutes, so I'm going to ask this question because I think it's important. So when you're going through this process and you're trying to get them committed, and one of the objections they bring up is, Dr. Eric, how much is this going to cost? Take us through how you would handle that situation.
Yeah. And let me just clarify something. I've done buy-in and they said they're in and they said how much it's going to cost, but they want to move forward with the plan. They say how much it's going to cost?
Yes.
Okay.
Well, let's go with that. Yeah.
Okay. So if I have buy-in to the problem and then they ask me how much it's going to cost, that's a normal thing. That's just a question, because look, guys, when you go shopping and you see something and you think you like it, I love shoes. I'm a sneakerhead. I love shoes, Nikes, Jordans. Those are my thing. And so I'm looking at the price and I'm saying, well, I really like these, but I'm not going to pay that much for them, right? So value starts to play a role. I value certain things more than others. So if we're just trying it on, looking at the price tag, that's very different than someone that says, yeah, I can't afford that. So when they say, well, how much is it going to be? I said, that's a great question. I'm so glad you asked that. We have Rebecca, who's dedicated. She's an expert at making sure that we maximize your insurance and we figure out how to fit this into your budget. So she'll go over all the cost with you, but the total cost is $5,000. How do you feel about that when I say that, Dr. Harrison?
Oh, wow.
Now comes the real objection, right? Now here comes the roadblock, okay?
Yeah.
They go,
well, that was a little bit more than I had thought. Do you, could I split that up into 2 payments?
yes, you can. Do you take cash? So now if he goes, oh, I didn't realize that was so much. I don't know how I'm going to do that. Well, we're here to help you figure that out. If you agree with this plan and it's just figuring out how to fit this into a budget, we can work our magic and help you figure that part out. How does that sound?
Yeah. And one of the questions I learned, I don't know if it was from you or not, but asking the question, are you concerned with the overall cost or are you concerned with fitting it into
your budget? Yeah. I think we worked on that years ago. Yes.
So that's a way to phrase that, because you might be surprised. And another thing that you can tell them is you can say, tell me more about your concern.
Anytime you're stuck, there's 5 words that'll get you out of trouble. Tell me more about that. So when they say, oh gosh, that's a lot of money, I'm not so sure. Tell me more about that. Is it the total cost or is it figuring out how to fit it into your budget that you're thinking about? One changer, Dr. Harrison, I don't plant the seed of concern outside of conditions of the mouth. Like, are you concerned about time? Are you concerned about budget? Are you concerned about, right? So I leave that out unless they tell me they're concerned first, then I'll be okay using that word when it comes to life circumstance. So, yeah.
So, yeah, you'll be surprised sometimes when you ask them to tell you more about it.
Yeah.
You'll be surprised. You think in your head, you know what they're thinking, that it's too much money, that they can't afford to do it. You have all the negative things in your head. I remember one time I was presenting treatment to somebody and I thought they could only pay a certain amount. So I was going to let them pay $50 a month. When it got to that point, I said, well, how much can you do?
Yep.
It's like $150 a month. Great. Because I was going to let you do $50 a month. I didn't say that to them, but I was surprised. But it was simply because I asked them the question and they gave me the information. And we could get into a whole nother conversation.
Oh, yeah.
What happens when they come back to you and say $20 as far as avoiding no.
Yes.
And using the word yes, that's a whole nother lecture and that type of thing. But any other questions for Eric today?
So you should have my email address if you have questions. I'm on the social media page. Yeah.
So I know one of you saw his Ricky Bobby presentation on our Facebook page and thought maybe he was a spammer, and they reported you to me to get you kicked off of the page. And I was worried about that, but he is a part of this group. He's a great resource to reach out to. He's not a spammer on there. So, but again, Eric, thank you so much for being here with us today. Really appreciate it.
Thank you, guys. Take care.